Hello and welcome back everyone to our YouTube channel. Today we are presenting an educational and informative video on Bell's palsy, that is one-sided face paralysis. Bell's palsy is defined as a sudden onset, one-sided or unilateral facial weakness. It usually worsens over 48 hours and gradually recovers over next 3 to 6 months. It is important to note that this is not a contagious disease. Face paralysis can sometimes be an early sign of a developing stroke. So it is important that before labeling Bell's palsy, we should rule out stroke. Patient with Bell's palsy usually present with one-sided drooping eyelid, inability to close the eye. This leads to dry and red eye. There is also inability to frown, inability to smile. There is deviation of mouth. There is drooling of saliva from the same side, and there is altered taste in mouth also. Major cause of Bell's palsy is not known, that is idiopathic, but the underlying mechanism involves inflammation of facial nerve. Common viruses are implicated in Bell's palsy like HSV1 virus and the chickenpox virus. There is also some role of adenovirus, Epstein-Barr virus, or cytomegalovirus. Sometimes Bell's palsy can develop as an autoimmune response, for example, to certain vaccines. Following are the risk factors predisposing for development of Bell's palsy, like hypertension, diabetes, obesity, high triglyceride type of cholesterol, low HDL level, pregnancy, migraine, and even certain type of cancers. Bell's palsy is a clinical diagnosis, but it is better to rule out stroke by doing a MRI brain. And some blood investigations are advisable, like a complete blood count, kidney function test, lipid profile, thyroid profile, and levels of blood sugar. Most of the times, Bell's palsy gradually recovers on its own also, but it is better to follow a treatment protocol involving a short dose of corticosteroids, antiviral drugs, multivitamins including B complex, vitamin E, zinc, care of eye, and physiotherapy. There are some additional treatments which are also promoted in treatment of Bell's palsy, like injection of nerve growth factor, and infusion therapy involving a mixture of corticosteroids, dextran, and pentoxifylline, cold laser or photobiomodulation, facial fillers and Botox injections, and mirror biofeedback training. Precautions which a patient with Bell's palsy should take, and the most important of this is a care of eye. This can be easily achieved by the use of goggles, taping of eye while sleeping, or even eye patch and eye ointments. Patient is advised to consume easily chewable foods and to eat slowly so as to avoid coughing. One of the important causative implicated in Bell's palsy is a herpes simplex virus. So any diet modification which decreases the strength of this virus is helpful. So we advise a low arginine and high lysine diet. It is important to avoid foods containing high arginine like peanuts, walnuts, almonds, cashews, pistachios, etc. While most of the patient of Bell's palsy recover quite well, there is an important phenomena called as synkinesis which develops in some of these recovered Bell's palsy patients. Synkinesis is involuntary facial movements, and these happen due to aberrant nerve regeneration. That is, facial nerve which was supposed to grow naturally, it branches aberrantly and attaches to different areas. So there can be eye closure while smiling, and there can be tear formation while eating. This phenomena is also called as crocodile tear formation. It is important to remember that with early diagnosis and treatment and a good physiotherapy protocol, good recovery is possible. Thank you for watching the video. Please like and subscribe our YouTube channel for more informative videos on brain and spine.